Hi there, my name is Helen Manchester and I'm the Operational Manager at Queen Mary's Hospital in Sidcup. I'm here to present how we have worked with our patient experience group over the last 7 years to make Queen Mary's Hospital what it is today. A hospital designed together with our service users to create a welcoming healthcare environment fit for the 21st century.
Following the dissolution of South London Healthcare in 2013, the future of Queen Mary's Hospital was unclear. A&E and maternity services had closed, evoking anxiety in the local community. The fabric of the building was crumbling, site costs were unsustainable, and its future as a healthcare facility was in doubt. The refurbishment of site services needed to be undertaken because running costs exceeded income, and a lack of investment meant the hospital was in need of modernisation to accommodate redesigned clinical services. In addition to this, 30% of the hospital was empty, and only 36% of the occupied space was used for clinical activity. Patient experience of the environment was poor, the site services lacking, and wayfinding tricky. With this in mind, the public consultation, Queen Mary's A Bright Future, was launched. We recognised early on there was a strong community connection with Queen Mary's, and it would be essential to have service users involved as partners. We understood the nature of engagement would be extensive, and at this point we worked with our commissioners to recruit a dedicated patient experience group. It was evident if services were to work for those who need them, we must draw on their knowledge, understanding, experience and aspirations for the hospital. Partnership working and co-production were essential in ensuring that the vision and development of Queen Mary's Hospital site created a better patient environment and experience of care. In partnership with patients, local people, commissioners and 14 healthcare providers, we collectively designed and agreed our vision. A review of Queen Mary's environment, services and site. Our challenge began. We wanted to provide specialist care closer to home for Bexley residents in an environment which enhanced patient care and ease of access. The patient journey from start to finish needed to be smooth and as supportive as possible, the environment specific for the type of care needed and delivered, whilst being both financially and environmentally sustainable for the future. The project was split into different stages and focused on various areas of service development. During each phase, we presented and openly debated the plans with our patient experience group, encouraging co-design along the way. Regular site visits were undertaken, as you can see here in the picture. The group also helped us to undertake a significant survey of site visitors' views on parking, wayfinding and signage. To ensure that we heard the voices of those with protected characteristics, we visited a number of local groups, including the Bexley Patient Council and Pensioners Forum, and the Bexley Health and Wellbeing Scrutiny Committee, where we presented our plans for feedback. This approach was broadened to include the local community faith leaders as the multi-faith space on site was reviewed. We also created a public newsletter with invitation to comment on plans as they were shared, and tapped into our local CCG mystery shopper scheme. Throughout the process, we fully embraced the ethos of co-production. At different stages, patient champions and community groups worked with professionals to co-design environments of care appropriate to the service user and department. You can see here pictures taken during the design of both the Specialist Children's Centre Acorns and the Adult Learning Disability Department, where the wall decor was created. It was a memorable experience for all. Our patient experience team continued to contribute throughout the redevelopment, for example, choosing the calming and welcoming colour within the cancer centre. We also liaised with the wider community, and school children visited the construction site in partnership with the Ivor Good Site scheme, learning about the construction industry, their local hospital and safety on a construction site. Their artwork brightened the hoarding used during the building works. We took testing and selection of our new kit seriously. Our patient experience team helped to design technology pathways and select the comfiest waiting chairs, all before social distancing was brought into play, of course. The outcome of our co-production over the last 7 years has meant that we have more than doubled the amount of clinical services, halved the unoccupied space, created financial sustainability and achieved our goal of a bright future for Queen Mary's. Queen Mary's is now a thriving healthcare hub for local people, designed with staff, patients and carer involvement. The environment is inviting, spacious, easily navigable and conducive to patient well-being. We have 14 different healthcare organisations working seamlessly together to provide a range of high-quality healthcare services for Bexley residents and the surrounding area. The services on site include elective surgery, outpatients for both mental and physical health of children and adults, therapy services, imaging services, radiotherapy, chemotherapy, dialysis, inpatient rehabilitation wards, mental health wards, women's health services, diabetes services and an urgent care centre. Specialist services such as the Cancer Centre mean that patients can receive treatment closer to home as we wished, and easily accessible technology in the urgent care centre is in use to speed up patient pathways. Lower infection rates mean that local residents want to come to Queen Mary's for elective surgery, whilst outpatient activity provides a one-stop shop approach to clinical care. The integration of social, mental and physical health services for children and people with learning disabilities benefits the service user no end, and we have received feedback which reflects this. During our project, our patient experience group specifically influenced the design of the main entrance to the hospital, the cafe facilities and location of snack points, wayfinding, the use of colour zoning and the type of language used in signage, waiting room chairs and layouts, the use of interactive travel designs, and the decor within the Children's Centre, the Adult Learning Disability Service and the Cancer Centre. Following on from the completion of the main refurbishment in early 2019, we continued to meet as a patient experience group whilst smaller projects finished. The focus also altered slightly to encompass more operational issues. The mystery shopper scheme continues on site, and patient representatives frequently visit departments and collect feedback from service users. This information is regularly shared with the 14 healthcare organisations to highlight where improvement is required, as well as celebrate and recognise good practice. Over the years, strong working relationships have been formed with our patient experience volunteers and stakeholders. Although our patient experience group has been paused, we've agreed to reform if further environmental co-design is required. To celebrate the input of the patient experience group and the redevelopment, we have presented our project, A Hospital Designed with You in Mind, at our annual general meeting and displayed this poster work around the hospital itself. Many of the patient experience volunteers have become involved in other projects as a result of this work. Our commissioners also shared our success with the Bexley Patient Council, the Bexley Patient Participation Group and with the CCG Equality Patient Experience and Engagement Assurance Committee. We have also hosted visits from several external trusts looking to complete similar projects, NHS England, local MPs, councillors and CCGs. Over the lifetime of our project, we have learnt, as I'm sure we'll all say today, that feedback from patients with lived experience is invaluable. An open attitude to stakeholder involvement and an ability to develop honest and open working relationships have been key for us to bring out the best in co-production. By treating all stakeholders, patients, commissioners and healthcare providers as partners, we really feel like we've achieved the best for our patients, visitors and staff alike. The flexibility of the hospital team was tested on more than one occasion, and we also quickly realised the need for a wide range of stakeholders when we have some lively debates within our group. It's been an absolute privilege and an unforgettable experience working with such a brilliant group of patient volunteers and patient experience team members from Bexley CCG. Many thanks for taking the time to listen today.